Hi everyone, I'm Sasha Watkins and I'm a registered dietitian and a co-founder of Field Doctor, where we make healthy frozen ready meals to help people with various conditions and to help them on their health journey. I'm really excited to be talking to Martin today, who's also a fellow registered dietitian, and we're going to be discussing the role of diet in the management of arthritis, what you can do, what you should think about doing, and maybe what you should also think about avoiding doing. Martin, over to you for an introduction.
Oh, thank you so much for having me. My name is Martin Lau, and I'm a dietitian for, over a decade now. I started off my career working for an acute hospital, and then I found my niche, working for people with arthritis. My day-to-day really is to run the dietetic clinic for Arthritis Action. And also I do act as a guest speaker to communities, also to some of our online support group. And then occasionally, if I get really lucky, I get invited to speak at conferences. And recently, I have been, well, certainly during the lockdown, I have been, helping people living with arthritis by getting them to do a little bit more exercises online. And now I will be restarting this online exercise class again. And now, before you mention, what do a dietitian know about, or giving advice about exercises? I am also a strength and conditioning coach. Apart from my keen interest in nutrition, resistance training, I also help people to get to grips a little bit more on their persistent pain as well. And finally, blowing my own trumpet a little bit, I am a task force member for the European League Against Rheumatism, which is a big organization, for helping people or supporting people with all different forms of arthritis. And one of the area that I'm working with is the non-pharmacological management of lupus.
Wow, what an amazing, varied role. I bet every day must be very different for you. For those that don't know about Arthritis Action, I know that there'll be a lot of members of Arthritis Action that know very well what you do. But could you maybe perhaps just give a little bit of an intro, what Arthritis Action does, what services are offered?
Sure. We are quite unique. Arthritis Action is a charity, is a UK charity offering an integrated self-management approach to help address physical and mental health symptoms of living with arthritis. It does offer a huge range of services, including personal dietary advice, access to clinical appointments with approved practitioners, and also an opportunity to take part in self-management events and online groups.
Excellent, excellent. So should we kick off? And
Please.
I think let's start with the first basic question to build onto is, what is arthritis? And perhaps could you just explain the different types? Because there's not only just one type of arthritis, is there?
Sure, yes, yeah, indeed. Now, arthritis literally means the inflammation of the joint. It does belong to a family of conditions called musculoskeletal disorders, or for short, MSK. And if you have ever been refer by your GP to a specialist group of physios, you often wonder, why are they called the MSK physios? And this is exactly what it means, musculoskeletal. Now, it is actually a grand family term, which also including back pain and osteoporosis. Now, there are over 100 different types of conditions that affects the joints. Perhaps if I can highlight two main groups of conditions which encompass some of the common types of arthritis the general public may have heard about.
Yeah,
So for the first group, it will be the condition of MSK pain or musculoskeletal pain. Now, this is the main representative, the main representative in this category is osteoarthritis, or OA. You will certainly hear me, bounce this term a lot in this webinar. Now, at the moment, there are around 8.5 million people living with this condition in the UK. It is one of the most common type of arthritis, and globally, it accounts for 14 million years lived with disability.
Wow.
The second group will be the inflammatory conditions. They are less prevalent compared to OA, but affects a large proportion of people in the UK. So first of all, for over 400, well, roughly around 400,000 people, which is just around 1% of the UK population, have rheumatoid arthritis or RA. Children do get arthritis too, because most of the time people would think that, oh, arthritis, it's an old person's thing, but it's actually not. Around 12,000 children have something called juvenile idiopathic arthritis. Around just above 200,000 people will have axial spondyloarthritis, and around 100,000 may have psoriatic arthritis. And finally, gout affects 1 and 2 in 100 people, mainly men over 40 years old and also women after menopause. In fact, Sasha, I have got a little slide that can share with the audience a little, just to differentiate a little bit more about the three main types of arthritis. I'm going to share that, if I may.
Brilliant.
Okay. Right. So I have got a nice little illustration here, which depict the normal joint. So everything's sort of like working quite nicely. The bones look quite intact, quite pretty. But if we go down looking at the joint which has got osteoarthritis. Now, traditionally, OA has always been focusing on the waxy layer, the shock absorbers, the cartilage. But in fact, we now understand a little bit more about this condition. It is actually more than just the wearing thin of the cartilage. The whole organ is affected as well, namely the tendons, the ligaments, the muscles, and also the bones. And this picture quite nicely shows that there's a little wearing thin of the cartilage, and I do have a nice little picture that I'm going to share with you in just a moment. So that is OA. RA, now rheumatoid arthritis or inflammatory arthritis, they are an autoimmune condition where our own immune system, our own soldiers, attacking the lining of our joints, which cause pain and discomfort. And then if we look at gout, gout is a condition where our body have got such a high buildup of uric acid. Now, uric acid is a metabolite which is from purine. Purine, it produces naturally in our body, and also a third of it comes from our food. And what happened is, with that buildup of uric acid, it then get into our joints, our joint fluids, and also tissues. And as times go by, it then precipitate into little crystals. Now, I'm sure we all have made little copper sulfate crystals when we were younger, and this is exactly what happened. And then somebody once told me that the pain experienced from gout is on par with childbirth.
Wow.
Okay, so this is a little picture. I do apologize for the quality of it, but it does show about osteoarthritis. As you can see, this is coming from a knee joint. For a young, normal person, nice, white, waxy layer, it's quite dense. And then you look at somebody who is a little bit older, but is also, retaining that the thickness of the cartilage. Again, it is you can see there's a little bit, of wearing down. But the medial, which is the M, and the lateral side is still pretty good looking. Now, in contrast to somebody who has got osteoarthritis or OA, you can see that there are definitely some degeneration there. And sometimes people often think that, oh, it may be, it might, the actual wearing down of the cartilage is uniform, but it's not. It can be sort of like slightly lopsided. It's certainly not something that just like wearing down a washer. It can be, it can be jagged edged, and that sometimes produce quite a lot of issues.
Gosh, that's amazing. I think it really helps to see images.
Okay, so let me go back into the next question.
Yeah, so I think, having seen those images and the two main, I guess, focusing on the two main different types of arthritis, so OA and RA, if I can abbreviate them like that, is, what causes them? Are there two different causes for the different types of arthritis?
Yes, but you may see a little bit later when I show, or when I put the slides up again, there are some common denominators. So again, I am going to put up some pretty pictures. Okay, so the risk for knee osteoarthritis, and I think it might be really useful to sort of like focusing on the knee, because the majority of people who's got osteoarthritis, I would say that 85% are mainly dealing with the knee issues. Now, you can see this lovely little pie chart here. The risk for a knee osteoarthritis, the majority is from people who are carrying more body weight than they should. Any sort of trauma or sporting injuries, also place you at a quite higher risk. Occupation. So any sort of like handling abnormal load on a day-to-day basis. For example, baggage handlers at the airport, because they have to, carry luggages, on a day-to-day basis. That, in some ways, will put them in a slightly higher risk. And in terms for the segment for others, that can be age. Because over 45% of people who have got OA, they are over 65, and also gender, and being female, unfortunately, do kind of like put you in a slightly higher risk category. And for risk factors for inflammatory arthritis, like rheumatoid arthritis or RA, genetics plays a huge part. And also different environmental factors, like, again, carrying more body weight or fat than you should. Even viral infections can trigger somebody that who may have RA. And smoking is well established. Is there something that could certainly steer people into getting RA if they are susceptible for this condition. So these are all the risk factor for the two sort of main type of arthritis.
Thanks. That's really informative. I mean, obviously, looking at some of those causes, there are some things that we cannot change. We cannot change our genetics. We
Mhm.
cannot change age, and to a certain extent, we certainly can't change getting certain viral infections, as we've seen over the last few years. But there are some things that we can do, it would seem, from lifestyle changes. So, what are those, and what does the science say in terms of how effective they are in helping people manage their arthritis?
Okay, I think I can be quite short and snappy for this one. Certainly be of a normal body weight. Um, don't smoke. Enjoy your food, but not too much. And also, enjoy being physically active. After all, the human body is not designed to be sedentary.
And yes, I love that line about enjoying food just a little bit in moderation, because it's something that we often say as dietitians.
Mm.
Could we unpack diet a little bit more, and what the evidence says about which diets can help, and how strong is the science in this space?
Right. Extremely fantastic question. This is also something that I am passionate about, but highly frustrated. Now, it is quite a complex issue in terms of looking at the science on diet and arthritis, because really there's no definitive answer. And as you probably know, if we want to do a nutrition study, there are so many confounding factors that can be at play. So in the end, the recommendation so far from for most of the clinical trial is there are no specific diet that can help to reduce symptoms. I know it sounds a little bit, depressing, yeah, but I do know that, and there are something, well, certain type of eating patterns that could sort of have some benefits.
And could we expand a little bit on the eating benefit, on the dietary
Sure.
patterns? Because I think everybody loves the idea that there might be specific
Mm,
superfoods that work, and that you can
mm,
just sort of take this magic pill. But actually, in truth, across lots of different conditions, and over the body of evidence, there seems to be mounting evidence towards it not being about individual foods, but very much about dietary
yeah.
patterns
Mm.
where these foods work together. And it's not just what you're eating, but it's also what you're not eating. So yes, which dietary patterns seem to work
Yeah.
in the favor of arthritis?
And I think, you kind of like nailed it on the head, because we don't eat individual, nutrients. We eat a diet, we eat foods. Now, I don't know whether you have, seen or even read in newspaper articles. They're saying that, oh, some individual cut out a massive food group, and then that basically helped them to achieve remission. Now, like most things, there are certainly outliers. I have, in my experience, I have, seen people so like, cutting out, a massive food group, or cutting out certain foods. It certainly helped them to reduce some of the symptoms. But these are, quite small and few and far between. And so, for the majority of people, the Mediterranean diet, the Med diet, appears to support both OA and RA. One added aspect, really, that I want to give our RA a little bit more of a focus is because of the nature of this condition. Because RA is a systemic condition, and people living with this disease, they are at a high risk of cardiovascular diseases. And as we know as dietitians, that there are a lot of evidence to support the Met diet, and also for it being, cardioprotective. So I guess that, from that standpoint, Met diet can be quite useful. Now, vegetarian or vegan diet has some evidence behind that too. Recently, I know there are a few sort of like small trials looking at a low carbohydrate diet. And how they sort of like manipulate it is because, by sort of like reducing the calorific intake, it may help to suppress, some of the inflammatory pathways. Even though that it does sound quite attractive, and then some individual tried it, it's sort of like help them, for short to medium term, but we still need a little bit more data to support that. But overall, my concern really using sort of like such a low calorific diet, namely is because we do have patients who are dealing with rheumatoid cachexia, and we certainly do not want them to lose any more lean mass. So in my opinion, going back to the basic, a healthy, varied eating pattern is most suitable for everyone. I know it's boring, but it does suit everybody.
And I think just for those who don't know the Mediterranean diet, we're big fans of the Mediterranean diet across at Field Doctor, just because of the evidence across cardiovascular disease, diabetes, mental health, sort of maybe some early evidence around arthritis. And we know sort of it plays a role in terms of, anti-inflammatory outcomes. It's, higher in fruits and vegetables, healthy fats from nuts, seeds, extra virgin olive oil, fish, legumes, very important part, eating meat in moderation, and lots of whole grains as well, and part of this. And we think it works very much via this route of the gut microbiome, and all the complexity and the polyphenols and the fiber and the good fats that are coming in this diet play a role. But I think, as always, there's, I would always think of that as very much kind of a good, solid diet. I think everything we see out there in terms of guidelines says, eat more fruits and vegetables, eat your whole grains for steady blood glucose and so forth. Now, which diets have been shown not to be helpful for arthritis? Are there any diets that could make you worse off?
Certainly an eating pattern that provides a lot of saturated fats, sugars, and ultra-processed convenient foods. Sadly,
sounds like the diet most people are eating.
Sadly, all the yummy foods are in this category. So we're talking about all the biscuits, the takeaways. don't hate me for this. But as dietitians, we rarely say that cut out completely. But certainly,
I had a takeaway last night
that I just mentioned, we should be eating less of.
Yeah, I think definitely. And I think it's about balance and starting to, even if you can make that change to eating less of, and just, small changes can grow into bigger changes.
Definitely.
What about supplements? What's your view on supplements? I think obviously there are a lot of supplements promoted in this area. Is there any good science to support them, or the need to spend the money that lots of people are spending on supplements?
Right. Now, this is a question that I do get asked all the time, and I'm so glad that you have asked me this. Because when people are talking about ways that they can help themselves, obviously looking at their nutrition, their weight management, and also things like some of these specialist supplement can also be something that they consider. Not only that their friends and family probably mention that, or even on the Sunday paper, the insert usually have got something like snail supplement that can cure of your arthritis, and they all sound too good to be true. So I am going to share something with you. So I'm going to go back into sharing my screen. Okay. It may look a little bit busy, but it is a really powerful um, uh, um, um, analysis looking at some of the supplements for arthritis in the market today. And I think this study is eloquently done. So what it looked at is they examine different supplements that has been purported to be helpful to arthritis. Sadly, you can see some of them are absolutely no good at all. In particular, one of the more common one or well-known supplement, glucosamine, as you can see over here, this is is of no use. Even sort of like looking at short to medium term, it is just not good enough, for people that they can, or even for from healthcare professionals to turn around and say that yes, I am confidently going to ask you to try this. And in fact, in the 2014 NICE guideline for osteoarthritis management, in the big letters saying that do not prescribe or recommend glucosamine sulfate or conjointin, to people with osteoarthritis. So that's enough said. Now, for some of those who understand meta-analysis, they can see that, oh, okay, maybe there are some interesting supplements like boswellia, curcumin, that sort of like I'm looking at, it favors the supplements. But there is one massive word of caution here. Some of these trial or the studies being used, the methodology, they're not sound, put it this way, and also they are only sort of like seeing some benefits in a short-term basis. So my sort of advice would be, if you wanted to try, let's say, glucosamine, by all means do so, because generally they are quite safe. But with glucosamine, you need to try it for at least 6 months to a year onwards to be able to see something. But I would just say that, I mean, just after listening or looking at this slide here, there really is no benefit for you to give it a go. And for some of those who are actually using it and see benefits, absolutely fantastic. In some ways, carry on using it. But I do feel that we need more concrete data on on things like turmeric, or other things like collagen and things like that.
Yeah, I think it's fascinating to note that you look at that and you think, oh gosh, green-lipped mussels, something, some of those I'd never heard of, but there's only one trial to support them. And in fact, the more robust evidence comes with more trials in more people, which I saw was sort of the chondroitin and glucosamine. Sorry, I hope I said those correctly. And of course, they were going close to that line or touching the line. Thanks for sharing that. I thought it was very interesting. So if you were going to give 3 nutritional top tips to someone watching today, what can you share?
May I have 4 tips, please?
I'll give you an extra one.
And I will explain the reason why, because in terms of the treatment for OA, it is mainly, well, at this moment, is mainly focusing on reducing symptoms. And to be honest, around 78% of people living with arthritis experience pain most days. Understanding persistent pain is definitely going to be a huge benefit. Now, an element directly related to nutrition, it's not about different nutrients or different foods that we eat. It's actually the accumulation of excess body fat. Therefore, the loss of excess body fat or body weight, if indicated, can reduce pain and improve physical function. And there are plenty of evidence to support it. And in fact, one of the pillars for the management for osteoarthritis in the clinical guideline clearly stated that weight loss, if indicated, will be definitely part of the treatment, or even, I would say that more strongly, management, or I'll say it the other way around, actually, rather strongly, is the treatment of osteoarthritis. And this is quite a fun little statement that I always bounce to the audience if I talk about the weight management and OA. And do you know that if you can lose 1 pound of the body weight, it lessens 4 pounds of pressure on the knee joint every step that you take? That is the reason why losing excess body weight or body fat can have such a tremendous effect on OA. Now,
extraordinary stat.
And interestingly, there are also evidence to show that nutrition has a key role to play in moderating persistent pain. So here are my 4 nutrition tips. So first of all, I do feel that a lot of our audience will find this really interesting, is keep well hydrated at all times, because dehydration increases the sensitivity of pain. And point number 2, mainly for the fruit and vegetables, eat a rainbow. Now, as colorful as they come, they also have got quite a lot of different antioxidants and also phytochemicals that may be able to modulate the inflammatory pathway. Now, one thing that I would like to stress is they are no way going to be as powerful as medications to bring down that fire. But at the same time, we need to do everything possible to help with our body. So, the government has guidelines saying that, a minimum of 5 a day. I would definitely trying to increase that a little bit more. And as colorful as possible, then that would be something that you need to reach out for. And then point number 3, place a focus on dietary fiber. And it's something that, Sasha, you have alluded to earlier. And if you have have got point number 2 covered, it is likely that you will have good enough content of fiber in your diet anyway. But focusing a little bit more on the whole grain carbohydrate will be sensible as well. Now, there is some emerging data looking at the gut microbiome and persistent pain, especially inflammatory pain. So, this is something that would be quite useful to to understand a little bit more of. But as we do know that fiber is a main source of nutrient for our gut bacteria. So definitely something that we will need to look after them, and in turn, they certainly will look after us in sort of like quite cliche kind of way. And point number 4, focus on polyunsaturated fats like your omega-3, 6, and 9. And in food terms, these are the fish oils. Omega-6, you usually find it in avocados or any sort of the plant-related fat, apart from coconut. And also omega-9, exclusively you will find it in olive oil. Now, we have a decade worth of data showing positive effects of fish oil for people with inflammatory arthritis. This can't, in some ways, this this positive effect not really carry over to those who are living with OA, even though OA has got an element of inflammation within the organ itself. But we do understand that with OA, The main contributor of pain is through the changes in bones, especially when the two bones starting to rub together without that sort of a waxy layer, and then you get a build-up, of fluid inside the bones. Is something we call the bone marrow lesion, and then that is, that is something that we know it can be contribute to a lot of pain. But I'm digressing here. If you are a vegetarian or a vegan, if you wanted to obtain omega-3s, seaweeds or marine algae provides a very good source of omega-3. And also sort of, my message will be making olive oil your principal oil.
So I'll do a recap, because I actually think that was 5 points, not 4. The first one, weight loss, is good.
I would try to sneak that in without you knowing.
Sneak that one in. Second one was hydration and staying hydrated. Third, eat a rainbow. Fourth, look at your fiber intakes, and I'd say sort of like a diversity of fiber is very helpful. And then fifth, looking at sort of that healthy fat intake via, I guess, omega-3s, oily fish, and extra virgin olive oil. Fabulous.
Isn't that interesting that when we talk about the Mediterranean diet, these sort of these 4 points, if we sort of like kick the body weight aside, it's kind of like fitted in quite nicely.
Yeah, it definitely has. And if you also look at Mediterranean living habits, they're also very active, which probably also leads to a lower BMI or lower weight. So, maybe that also means that first point becomes less important for them because they're constantly moving.
And before I forget, I think one final point that, or certainly, an important point that I would like to say about dealing with persistent pain is we ought to look beyond the biological system, because we always, associate the pain with tissue damage, and and I think this is, not correct. And because we need to recognize that, other aspects in our lives that can feed into the pain cycle. And now when we talk about, pain management, we should look at something called the biopsychosocial model. So there are a lot of things that can, that can come into play.
Definitely. Any top tip for those that are looking to reduce their risk of arthritis? I'm sure it'll be a lot of people joining this call that, that actually have got arthritis, but perhaps some advice they want to pass on to friends and family to reduce their risk of getting it in the first place.
Sure. For OA, apart from the genetic factors mentioned before, reduce the risk of getting your knee injured will be, really useful. And then and traumatic injuries, something that I briefly mentioned about, like ACL injury, can often contribute to OA in later life. Keeping a normal body weight definitely help to reduce the risk of both OA and RA. Smoking is the best defined risk factor for RA. I'm just being, simplify it, because there's also another different subtype of RA that doesn't find that strong of a relationship. But anyway, we then talk of screening first degree relatives of RA patients, or even twins of RA patients, or even in population with high disease prevalence. However, I mean, this can be extremely costly, and I do not feel that, given what's going on with the economy today, that will be a possible thing to do. But going back to what I mentioned earlier, and I do feel that lifestyle does play a huge part.
Where can people get more information if they want to do a little bit more reading up?
Sure. The NHS website, and also patient organizations such as ARMA. ARMA stands for Arthritis and Musculoskeletal Alliances. of course, Arthritis Action, versus Arthritis, which is another national arthritis charity, NRAS, which stands for National Rheumatoid Arthritis Society, and also NAS, which is National Axial Spondyloarthritis Society. The patient organization usually gives one of the best information.
That's great. And I think, just to add a little bit of fine print there, it really does matter where you get your information from. Not all sources of information are accurate or correct. There's a lot of fake science news out there. So, definitely to go to these reliable and credible sources, and always check where your information is coming from. Just because a friend says this is the supplement you should definitely take to help your arthritis, as we've seen from the science itself, that may not be the correct answer for everyone. And then finally, just to sort of end the conversation, because I think we've covered so much, and thank you so much for sharing all your expertise. What is the final takeaway point that you would like to leave everyone with? If you could leave them with one thing, not 4 or 5, but one.
Yeah, I'm not going to be cheeky here. Okay, my takeaway point will be: don't feel that living with arthritis, I'm talking about all forms here, is a life sentence. Remember, your arthritis is unique to you. Learning more about your condition from credible organizations, try different management techniques that works for you, and become your arthritis manager. And I'm just do a really shameless plug here. And if you do need more information, do get in touch with us.
Oh, Martin, thank you. I think that was a really motivating point to leave on, just because I think when everybody's on their various health journeys, it can feel quite hard, can often feel quite lonely.
Yes.
And we know with chronic health disease, and I've seen
really overwhelming
arthritis, it's it does feel often like a life sentence, and we know sort of the effect on mental health that comes with experiencing constant pain. So thank you very much. I really enjoyed our chat. I hope everybody finds this information of value, and I think we've got to do it again. So much more I'd love to cover. So thank you very much for today.
Thank you for having me. Thanks.
And me.
Thanks.
Bye.
Bye.